Hi, everyone. Thanks for joining Western Center First of the Year, Meet the Advocates, Capital Edition. I'm Linda Way, Senior Policy Advocate working on healthcare. And before we get started, I wanted to allow the team to briefly introduce themselves. So we'll go ahead and pass it to Sandra Poole to introduce herself before passing to another advocate.
Yeah,
You might be muted, Sandra.
there we go. I'm Sandra Poole. What a privilege it is to work with such a dynamic team. I've been with Western Center since December, and I am on the health policy team. I will pass it on to Tina.
Hi, good afternoon. Tina Rosales. I use she, her pronouns. I am a housing policy advocate, and I will pass it to the second half of our dynamic duo, Cynthia Castillo.
Hi, y'all. Happy Tuesday. So happy to be here. My name is Cynthia Castillo. I'm also a policy advocate on the housing team. So good to see all these wonderful faces this morning. I can pass it to my colleague, Chris, if he hasn't gone yet.
Good afternoon, everybody. Christopher Sanchez. My pronouns are he, him. I am the policy advocate on the Public Benefits and Access to Justice team, where we do everything justice here in our portfolio. I'll pass it back to Linda.
Thanks, Chris. As you can see, we are a small but mighty team. And through the lens of economic and racial justice, we fight to ensure housing, healthcare, and a strong safety net for low-income Californians. We're co-sponsoring over 20 bills across our different policy areas, and this includes adding housing status to the list of protected categories under California's anti-discrimination statute, prohibiting towing or mobilizing a vehicle due to unpaid parking tickets, reforming and reimagining the CalWORKs program, and ensuring access to healthcare services, including wheelchairs, oxygen tanks, and hearing aids. So that is just a brief list of the bills. We will go more into detail in just a bit, and I'll kick it off to Tina and Cynthia from the housing team to highlight just a few of our housing priorities.
Cynthia, do you want to kick it off?
Sure. And if folks will allow me to kind of just take a step back and sort of like set the stage for where we are in the legislature. So, I think many folks came back after the legislative session last year and kind of got together over the fall to discuss like what are we going to prioritize in this coming year. And I think housing and homelessness is very top of mind and an issue that many legislators wanted to touch on this year. And so as a reminder, we have so many new legislators in the legislature, many of them who have never even held office before, folks coming from all walks of life, and a lot of people that have not essentially engaged on housing and homelessness policy. And so what we've known for the past couple decades is that we have a severe housing shortage and a homelessness crisis that's really hit a fever pitch. Over the past couple of years, we've seen an increase in legislation that makes it increasingly difficult for unhoused people to be, engaging in life-sustaining activities like sleeping outside or resting in places that are in public, frankly, because there are no other places for those folks to go. And so I think this year, Tina and I kind of put our heads together and we're listening to some of the legal aid programs about what was top of mind. And homelessness was definitely one of those policies that really kind of emerged for folks. In addition to homelessness policy, there was a continued effort on the housing team to talk about renter protections and the families, the low-income families that we serve that are still reeling from the pandemic, right? Like it's only 3 years. I think we got an announcement. It's been 3 years since the pandemic has started. And so we are still definitely in the midst of all of that. And folks getting back on their feet. And so I think you'll see in our legislative package that those are just two pieces that are really highlighted for us as renter protections, eviction protections, as well as homelessness policies. And of course, there's going to be the emerging and long-time issue of land use policy reform in California. And so those are like three areas that I just wanted to point out and sort of set the stage. And at this point, the legislature has introduced all of the bills that we're going to be wading throughout the year. There's still a gut and amend a deadline that's coming up. So what that means is that all the bills have been introduced, they have numbers, but there's still opportunities to see some substantive changes. And so you might see one of the bills that I'm going to be talking about that hasn't been substantively amended yet, but there will be language in there soon, sort of highlighting what we're proposing. So that's where we are. Many folks are starting to have their first hearing ever. So you're getting a preview of our bills, likely before they're heard in their first committee. And so there may be opportunities if folks are able to support those bills as they continue through the process. So I will start with one that Linda said up top, which is AB 920 with Assembly Member Isaac Bryan. And that will add housing status to the list of protected categories under California's anti-discrimination statute in order to prevent this routine discrimination of unhoused people by public and private entities that receive state funding. And so, you know, where we're coming from this proposal is that there are so many sort of factors that are protected under anti-discrimination law in California. So you can't be discriminated against because of your race, because your marital status, because of who you choose to love. And there are so many very, very important pieces in California statute so that you can't be discriminated against. But housing status and being unhoused is not one of those. And so it's very, very simple change to the language. We're just adding housing status. Housing status is defined as an individual that is currently experiencing homelessness or was experiencing homelessness upon entering an institution. That means if maybe they've went into the prison system, jail system, and they were unhoused on the way in, that when they're, you know, obviously they were in a certain location, and now when they're out, that they're still technically unhoused. And so these people would be protected by some of these what we've seen happening across the state, which is employment. You know, if someone is denied employment based off the person being perceived as unhoused, et cetera. And so we think this is an incredibly righteous issue, a starting point, and sort of putting our name out there and putting that line in the sand that we are seeing frequent discrimination being felt by our unhoused community. And so that is being co-sponsored by the ACLU, Disability Rights California, Housing California, and Public Advocates. So you can see a really, really great group of co-sponsors on that proposal. And Isaac Bryan helming that bill is incredible as a legislator based in the LA area who has personal experience, has a family member that have experienced homelessness. So we could not think of a better champion for this proposal this year. So that one's AB 920, housing status and anti-discrimination. So really excited to uplift that bill today. The second one, before I pass it to Tina, because I know I've taken a lot of space today, is AB 653 by Reyes. And essentially, there's been sort of two things that we've been really seeing across the state, which is individuals that use Section 8 vouchers. These are federal vouchers that help individuals, low-income individuals, lease up in the private market. And it's been a long time tool across the United States to house the most vulnerable, particularly families. And what we've known is that, you know, Western Center a couple of years ago worked on a proposal with Senator Mitchell at the time to make sure that these individuals were not discriminated against for being voucher users. And so we're still seeing widespread discrimination of individuals who have a voucher, and then they will find a landlord, and the landlord won't accept their voucher and will not accept their tenancy. Based off of, you know, frankly, racist and outdated thinking about who these individuals are. And so two issues I want to flag is that we are ensuring in the budget that we have funding for the department to go after bad actors and to go after landlords that are discriminating against voucher users. Then on the other side, we are working on this bill, AB 653, to encourage and increase voucher utilization across the state. And so it is such a wonderful tool that it frankly is going underutilized. And so the bill would create a program to pair housing navigation incentives, landlord incentives, and deposit resources for housing voucher tenants to find and secure a unit and increase our utilization rates across the state. Because we know there are folks that have been on waiting lists waiting for their voucher, then they get their voucher, and then there's sort of these hurdles in place where they can't even get the housing. And so a wonderful program that we have and trying to uplift that. And so that is being co-sponsored with Housing California, the Corporation for Supportive Housing, United Ways of California, and the National Housing Law Project. So a really, really righteous bill that we hope we can pair in sort of the narrative shift about ensuring that those folks aren't discriminated against for having a voucher, and ensuring that we can increase the amount of families that are accepted and can lease up under the voucher program in the state. So those are two proposals that I think are really exciting. I'll pass it to Tina, and then maybe there'll be room for more bills to talk about, but I'll stop there. Thank you.
Hi, so for the housing team, as Cynthia said, we have quite a few bills that we are working on, but the number one priority is SB 567 by Senator Durazo. And this is the Homelessness Prevention Act. As some of you may know, in 2019, Assemblymember Chu passed the Tenant Protection Act, which established statewide rent control as well as eviction protections for certain renters in the state of California. It was unprecedented at the time. However, as we've seen in the past couple of years, the pandemic has really, as well as the pre-existing housing crisis and homelessness crisis, has really impacted folks who are in the rental market, primarily who are renters. What we have also seen is that rent is increasing way too much, and people they just can't afford rent. Even with our 10% increase in 1482, it's just too much. So what we are doing is we are partnering with California Rural Legal Assistance Foundation, the Leadership Council for Justice and Accountability, Public Advocates, PICO California, and ACE to reform 1482 so that it can really respond to the present day needs of the California renters. And we're doing that in four main categories. The first is closing existing loopholes that allow for abuse for no fault just cause evictions. Those are things like owner move-in, removing from the rental market. The second is expanding the population of tenants that are covered under the ordinance. So right now, certain tenants, quite a few tenants are excluded from the ordinance. And we just don't think that's fair for certain tenants, depending on what type of housing you have to have protections or not. And so we're going to eliminate that altogether. The third bucket is we're still allowing rent increases, but the rent increases are going to be reasonable. Back in the days when 1482 was originally passed, the CPI was not an outrageous amount, and so 10% seemed reasonable. Unfortunately, we found that there's been a median increase of $100 per month for rent, and that led to a 9% increase in homelessness just in 2020. Those numbers are increasing now 3 years later. So we are going to limit the rent increase to something that's more reasonable. Right now, we are looking at a 3% cap, which is also consistent to other types of housing that has these caps. And the last one is all laws are great, but they mean nothing if there's no enforcement or accountability. And so we are providing mechanisms for accountability and enforcement in this bill. It's a huge lift. It's going to come with heavy opposition, but with that also comes heavy power from the community. And so we're hoping to get this passed and signed by the governor. And not to take up too much time, but the last bill is AB 1418. And this bill is, sponsored by Assemblymember Tina McKinner. We have the same name, so I'm going to shout her out. But essentially what this bill is going to do, there's a very harmful practice called crime-free / nuisance housing. And it is often touted as being a crime-fighting tool to prevent, crimes in the properties. And really, as we've seen through an LA Times article, as well as other data, that's not true. And so what this bill actually does is it's a response to people of color, primarily Black and Latino families, who move from urban areas into suburban areas. And the cities have enacted these policies of crime-free housing. And so it includes things like a person who calls 911 too many times can get evicted, or they're forced to be evicted by the landlord. It's a terrible policy. And so we are looking to repeal that with AB 1482. We have been referred to Assemblymember Judiciary, and we'll have more information about the LA Times report as well as the fact sheet. I believe it's been included in the chat, but essentially what we're really trying to do is undo some of the very harmful racist policies that we've seen popping up in some of the more affluent and suburban areas. Not just that, there are also areas, I live in Oakland, and we have similar things in the Bay Area. So I'm not just saying it's suburban areas, but this is a policy that happens often when people of color move into certain communities. So I will pass it back over to Linda.
Thanks, Tina and Cynthia. Our housing and homelessness team are working on quite a few bills. One thing I neglected to mention at the beginning is we do want this to be a conversation. So if there are any questions that pop up, feel free to write it in the chat or raise your hand. But with that, I'll just pause to see if there's any questions for Cynthia and Tina. They'll also leave time at the end, but I'll go ahead and pass it over to Christopher.
Hey, good afternoon, everybody. So when it comes to public benefits and access to justice, as you'll see from the link that Linda has provided in the chat, we're going to be really busy this year, but that's good. Why? Because we're really prioritizing families this year, and we're really strengthening the social safety net, and we're continuing our work that we've always done to ensure that workers are being protected when they're most vulnerable. This year, I really want to talk to you about two of those buckets, though, prioritizing families and the work that we're doing there, and then how we're really strengthening the social safety nets of California. When it comes to prioritizing families, you'll notice that we have two bills on our list, AB 310 and AB 1094. And it's really thinking about how do we ensure that families are always kept whole together, because here in California, our values have always been to have family unity and never to separate families, especially if it's only because of racial bias or only because of families living in poverty. And so with these bills, specifically for AB 1094, we're saying we just want to ensure that folks have consent, birthing people have consent, and written and verbal when it comes to drug tests or alcohol tests being administered to them, because it's their right when they're giving birth and also to their newborn. It's really a critical bill because unfortunately what has happened, what we've seen is that alcohol or drug tests that would be administered, and then if there's a positive result that comes up, and typically doesn't always result in because of the individual taking any drugs, the child, there begins to be the process of family separation. And just imagine having your child or a child removed at such a young age at a critical moment, and what does that entail for them and the parent? And so we're moving that bill forward, and we'll continue to have those conversations. But this is a really critical bill to Western Center. But in that same light, uplifting AB 310. Once again, we have programs that are meant for families, intended to serve families, but don't center families. And so we're fortunate enough that we've already kind of kicked off conversations in both the Senate and Assembly budget committees to talk about the issues related to reforming the CalWORKs program, and what does it look like to ensure that families are put first, and not saying, we have to have all these barriers in order to help somebody out, because, I think a critical component of this is that CalWORKs, it was created during the Pete Wilson administration. And as such, a lot of the Pete Wilson continues to exist in this program. So we're going to do a lot of that undoing, because no one should continue to be seen as someone who's trying to, work the system, quote unquote, as people thought back when CalWORKs was first implemented. Well, we're going to have some, robust conversations, and I'll say, I might be the only advocate in this portfolio, but my colleague Linda has helped me out tremendously. And so you'll see us working on it, and you'll see the litigators on my team also working on it. We'll be very visible because this is such a critical bill to us. Now, moving over, talking about strengthening the social safety net, we live in a century where in times where, sometimes a phone call can mean a whole lot, or snail mail could be critical to someone's life. But the way that we used to communicate in the 90s and the early 2000s is very different than how we do it today. And that's why we have several bills that will update how recipients are able to provide reporting, so that maybe they could do it through email, because that might be the best way for them, given, they're probably working a couple of jobs or so forth. Really codifying and ensuring that the restoration of CalFresh benefits that have been stolen because they've been electronically stolen, and our statute is old and says only if it's been physically stolen, is up to date. So, we're going to continue to go that route, and that would be codifying the court case that we won in 2020. And then, ensuring that folks are able to know who's calling them from a social service agency, because they're probably not going to pick up a block phone call in today's age. But they'll pick up a phone call if they recognize it, and especially if it's coming from an agency that they need services from. And I'll just lastly say, some of the things that Cynthia was mentioning as it relates to being on a housing list, you have to get that. In order to be on that list, you get notified through mail. But what happens if you don't have a reliable mailing address? Our current postal system is a little bit outdated, and it isn't as reliable as we would like it to be, because, competitive market out there for mail carrier services and so forth. So what do we need to do? We're asking that California create an additional option at social service offices across the state for individuals who don't have a reliable mailing address to be able to access government mail at the social service offices. And that's a bill, SB 491, with Senator Durazo. You get your ballot through the mail. Our democracy is received through the mail. Your jury duty notices through the mail. In order to get your CalFresh card, your CalWORKs card is through the mail. There's so many important things that come through the mail that are delivered from the government, and to help you to build out your social safety net, to secure you and capture you in that safety net, that we need to ensure that people are actually getting their mail. So with that, I'll wait for questions whenever, and I'll pass it over to Linda.
Thanks, Chris. There's quite a bit on your shoulders, and so we do appreciate the work you do. Not seeing anything in the chat or any hands raised. I'll kick it off on the healthcare side. And so we work on ensuring equitable access to affordable comprehensive health coverage. And last year was a good year for us. We were able to win a lot of expansions through the budget. And so working on the implementation of that, but also beyond just the eligibility coverage side of things, we're also seeking to improve comprehensive coverage. And so one of that includes access to durable medical equipment that Sandra will talk about.
So that's a handoff to me, Linda?
Yes.
Okay.
And then I'll round it back out.
So as Linda mentioned, one of the goals of the health team is to advocate for access for all Californians to quality care. And so a bill that we're working on is AB 1157, Ortega and Wilson, and it seeks to clarify coverage of necessary medical equipment. And this is co-sponsored with the National Health Law Program. The problem in California is that many Californians don't have access to wheelchairs, hearing aids, ventilators, or other durable medical equipment that they need. And this is because private health plans regularly exclude or severely limit coverage of this equipment. And that causes people to either go without medically needed devices, obtain inferior ones that put their health and safety at risk, or turn to publicly funded healthcare programs for help. And this is all happening despite the Affordable Care Act's clear mandate to cover essential health benefits, including rehabilitative and habilitative devices, which durable medical equipment falls under. So without adequate coverage, the lives of adults and children with disabilities are severely impacted. Many are unable to attend school, work, or participate in community life. So not only is this lack of coverage contrary to the Affordable Care Act requirements that I mentioned previously, but we also believe that the lack of coverage violates another key provision of the Affordable Care Act, which is Section 1557 which prohibits discrimination based on disability in any health program. So again, this bill would clarify that medical equipment is a covered essential benefit in California regulated health plans when prescribed by a doctor, and remove the limitation on annual caps on the durable medical equipment coverage when they do provide it. That just makes it cost prohibitive for Californians to obtain that. So we'll be looking forward to you all supporting that effort, and I will turn it over now to Linda.
Thanks, Sandra. And I will raise a bill that is actually a cross-team bill that impacts health as well as housing, AB 1085 by Assemblymember Mainshine. And what the bill would do is make housing support services a Medi-Cal benefit. You might ask, what is housing support services? And so those are services that actually connect an individual who's experiencing homelessness with housing services. And so that includes navigation to connect these individuals, as well as one-time deposits. It can also include tenancy support services, helping these individuals stay stably housed. And so it may sound odd that Medi-Cal, a health program, can it cover these services, recognizing that yes, it first of all can cover these services and does in many other states. And so California does have the infrastructure in place right now. Medi-Cal plans can provide that, but it's at their option. Many of them, all of them actually do, but because it's at their option, they can impose different sorts of requirements. And so there isn't really a standardization. And because it is at their option, they tend to focus on those that are high utilizers, those that are very expensive, those that might be entering the ER emergency room very often. And so it doesn't really get to the larger, it may only provide services to a small fraction of those who would be eligible. And so we would like to see this be a statewide Medi-Cal benefit so that it isn't at the plan options, and that the state can be able to draw down significant federal funding up to a 90% match. And so we do know there have been efforts underway, as I mentioned, through Medi-Cal plans, through investments from the state. And so want to move forward with that by actually requiring the state to provide that. And so this is both a legislative and budget ask. Some of our proposals recognizing that there will be a financial cost to things, include not just a bill going through the bill process and the policy committees, but also going through the budget process to secure funding and a commitment from the legislature and the administration to actually enact this. And so as I mentioned, it is both a legislative and budget ask, and we are working with the Corporation for Supportive Housing as a co-sponsor on that. So I will pause to see if there's any questions on any of the bills on the health side, as well as any of the bills that were previously discussed or maybe not discussed on our sponsored bill list that you say, hey, that sounds interesting. Happy to take any questions or comments.
I have a question for Chris. I know that AB 310 is being looked at as this revamping CalWORKs. Can you talk a little bit more about the different areas? Obviously, we know the origins of CalWORKs are super problematic, and even the name of the program is pretty offensive. I'm wondering if you could talk about what ways those revamping of the program through this bill could end up boosting enrollment, which I know is at an all-time low for the state.
Absolutely. And I'll kind of set the stage, and then Linda, if there's anything that I'm missing, feel free to jump in. But what you'll probably hear from a lot of folks that are recipients of the CalWORK program or that attempt to be recipients or that have applied is that there are many barriers to the program, to enroll into the program, to stay on the program. And once the individual is on the program, they have to go through hurdles just to continue to show that they're meeting all the requirements and so forth. And so a lot of times what we've been hearing from families is that, is it worth all the time and energy that I have to prove that I need assistance, that I need help to enroll in this program, or am I better off trying to figure out how to get assistance in other ways, through other avenues or through other programs? Maybe there's a local program, or maybe there's a program at a local church or so forth. But that's one thing we hear, and I think, you know, we recently had the budget assembly budget committee, and there was a participant who spoke and said, you know, I shouldn't have to feel a certain way about enrolling into this program, but it is very demeaning how I feel when I go to provide all the information that I need and to ensure that I'm up to date with all my requirements. California safety net should not be that way. This is California, the state that welcomes everybody and ensures that everybody is going to be taken care of. So I think that's kind of where we're coming from, listening to legal service providers, listening to members of the community. And this is the year we have to do something about it.
Completely agree. And that is why it is one of our top priorities, and glad you're able to highlight it, Chris. Sandra, I don't know if you saw the question in the chat, but from Patricia, she was struck when you mentioned children were with regards to durable medical equipment. Are children legally considered in the same category as adults for medical benefits? Sorry if this is obvious, but wanted some clarification there.
So make sure I'm off mute. So the issue that I talked about is related to individuals who are getting Covered California through individual plans and small group plans, which would also include the whole family. And so that's the group that we're talking about. Let me make sure I'm understanding the question here. I said in the same category. So if they are receiving their health benefits through those programs, then they would be treated the same as far as I know. And Linda, do you have anything different on that?
I would just note on the Medi-Cal side, there is a recognition that in terms of medical necessity, whether a service is medically necessary or not, it is much broader for children. And so that entitles them to sometimes a broader set of services. And so they are eligible with the recognition that children aren't just small adults, but have specific health needs on their own. And so when looking at medical necessity criteria, there can be different applications applied, but we do know that children are being denied certain durable medical equipment. And so this bill would apply, as Sandra said, not just to adults, but the whole family. Thank you, Patricia. Well, I know it's the lunch hour, and so I see a question from Sochi. Thanks for getting that in. Directed toward Christopher. Is Western Center partnering with other organizations doing birth justice work? If so, can you share those names?
Absolutely, and I think, you know, some of you might heard me cover AB 1094, and you're like, oh, well, this isn't completely new to Western Center, but tell us more. But we don't go into this policy area alone. We're partnering with organizations like Californians for Latina Reproductive Justice, Black Women for Wellness, the Los Angeles Dependency Lawyers, and Drug Policy Alliance. All of us came together, we found each other, and since we all have very different perspectives that benefit this policy area, we agreed that we should co-sponsor this bill and move forward with it. And let me tell you, the support for this bill is just coming in every day, and this is becoming more and more of an issue. There's an alliance up here, a coalition called Building the California Dream Alliance that Western Center is a part of, and actually was instrumental in the founding of that alliance. And that coalition has prioritized this bill this year, which makes a really big impact in the legislature because members recognize that alliance. It's a progressive space, and if it's a priority, then they do take an additional look at it and make sure that they really take consideration in supporting the bill. So we're happy to report that as well. And then looking at the chat, how does informed consent testing lift up other work being done? At least from my perspective, and I'll let my colleagues jump in. I think there was a bill that we did a couple of years ago. I can't remember the number, Linda. I think it was in the health team that was really trying to tackle issues related to mortality for birthing folks and for newborns and so forth, and what are things that California can do to ensure that Black and Brown communities of birthing people are given the support they need and are given the care that they need. And I believe the bill that we worked on last time was named the Momming Bus Bill with Senator Skinner. And so this kind of builds off that work that we had done previously. That was very much related, specifically to the health. And this is more along the lines, absolutely continues on that work with the health, but also ensures that children aren't separated from the access to justice piece as it relates to child protective services and so forth.
I'll just add to some of the bill numbers. I had to look it up a little bit, but the Omnibus bill was SB 65 and is currently in the process of being implemented, and so that that was a major bill that we worked with many of the partner organization Christopher mentioned, as well as other organization, as well as another bill that we worked on, SB 464 by Senator or then Senator Mitchell, since she is now supervisor. And so that one would require recognizing the very high mortality rates for Black people when giving birth, require implicit bias training for hospitals and providers. That bill is another bill as well. And then I see a question from Cynthia Martinez. How might our bills address the current situation of tenants assessing rental assistance? So I'll turn that to Tina and Cynthia.
Tina, you're on mute.
Yeah, sorry, I was reading. I think it would depend on what we define as rental assistance, and if we're talking about the Emergency Rental Assistance Program, which is a federal program that the states gave money to, our bills wouldn't necessarily address that, but we do have a lawsuit suing HCD over the misappropriation and of the funding. So we can probably follow up with the housing litigators on that issue. And unfortunately right now, because of the lack of federal funding and the dire state of California's budget, there's no indication that we will get additional emergency rental assistance funding. But if we think about rental assistance in the ways of allowing folks to access housing, then rather than an actual program, SB 567 will allow folks to access housing and then maintain their housing because we are reducing the rent cap which right now is 5% plus CPI, no more than 10%, to something that's way more manageable. Cynthia Castillo is working on the voucher utilization bill that is not necessarily rental assistance in the traditional sense, but it is a part of a federal program, the Housing Choice Voucher Program, that provides that, you know, offers a person, pays the rent essentially, no more than 30% of that person's income. There are some ways to that's not necessarily the case in very certain circumstances. But the problem with the vouchers, as Cynthia said, is the voucher, although we do have an increased amount of vouchers, the problem is using the voucher. And so the bill that Cynthia is working on will help not only individuals getting the voucher, but then being able to lease up or use the voucher. I hope that answered that question.
Yeah, that's helpful, Tina. And I just had a couple of thoughts about this, like sort of like zooming out. I think you're absolutely correct. The state understands that in the housing and homelessness space, that the one true, you know, the answer to homelessness is housing, right? And getting housing. And there's so many people that, because of inflation, all these other factors, are unable to pay the rent. And so, like Tina mentioned, all of those different like examples of rental assistance, right? The rental assistance that the state is giving for those people that were unable to pay during COVID, the rental assistance that is in the form of a voucher that we're trying to uplift and encourage, right? Another one I'll mention, it's not our bill, but I think it's a really great one. SB 37 creates a program for vouchers with folks on fixed income, so older adults, people with disabilities, and you know, that's also a very important group of people that are having difficulties meeting those high rents. And so you'll see that Tina mentioned that there's just so many different examples of the state trying to tackle that really huge gap from what the person is able to pay and the rest of the rent that is required. So you'll see that we're trying to chip away at that issue. I think for the past couple decades, but I think it's definitely something that's being increased. And I want to highlight one thing too that Tina embedded in her comments is that the governor has signaled that this year that we are likely to enter like a budget deficit. So last year, it's quite jarring for those who aren't following the legislature very closely, is that last year we had a surplus. And then now looking at this year, all projections are showing that the state will have less money in our funds. And so just as something to uplift on this call is that we're trying to get all of these really righteous bills and legislation done during a year where there's an expected downturn, and then trying to also ensure that we're funding the important pieces that we all work on in counter-cyclical moments. So for us, Tina and I in housing, that means we can't take our foot off the pedal now. If anything, it's more important to fund housing now while we're in a downturn. Otherwise, we're going to just continue to try to claw back some of what we're, you know, the essential deficit that we've been fighting against, right? During past downturns, there's been less funding towards housing, and then we're seeing the aftermath of that. It reverberates after years, right, of the lack of housing production, et cetera. So that's just a little aside that I wanted to uplift out of Tina's comments. There's a lot there that's exciting.
Just sorry, my colleague reminded me, just in general, as with a lot of the issues that Western Center works on, housing and homelessness falls on the burden of women, right? It falls on women's shoulders. And one of the reasons is systemic inequities, economic inequities, and today is Equal Pay Day, and we know that Black and Latin women do not make nearly as the same amount as white women do for their corresponding work, and that will also contribute to the housing and the homelessness inequity that we have. Be on the lookout for a post that talks about how housing is a women's issue and how women can be central to the solutions for it. But with that, I think Cynthia is going to address the comment about some bills that we are opposing.
Yeah, I see a question about what we're opposing. I've got two bills that are just top of mind that we put an opposition letter in and trying to squash. And so maybe there are other, I can say those really quickly, and then I can pass it to other colleagues that may have comments. So earlier this year, there was AB 257 by Assemblymember Hoover, and then Senate Bill SB 31 by Senator Jones. So there's two proposals that have very, very similar context. Essentially, both bills are trying to make it more difficult for unhoused people to camp or lie or sit or sleep near certain places. So it's SB 31 was introduced first, and that would ban unhoused folks from sleeping near libraries, parks, daycare centers, and schools. And then the Hoover bill had the similar areas, except it was more targeted towards playgrounds, youth centers, schools, and daycares. So Hoover would say you're unable to camp 500 feet of those critical areas that are related to where young children are frequenting. And if you don't comply with that, it is a misdemeanor with a fee, and you are it would up to also lead up to 5 days in jail time if you were not compliant. So clearly a bill that criminalizes being unhoused. There are individuals that are unhoused that are children. So that there's also falling on tropes about who the population of unhoused people are. We opposed that bill with a huge coalition of individuals. It was heard in committee last Tuesday, and it failed in committee, 6 no votes to 2 aye votes. We're incredibly proud of getting the votes to bring that bill down. It was granted reconsideration, which is just legislative lingo to say that if the author substantively changes the bill and can perhaps get the votes to have the bill heard again, that it is possible. But I think a lot of folks in that committee made very clear that criminalization as a response to our crisis is absolutely inappropriate. And so we're very, very happy to announce that that bill got killed in committee last week. And that, again, SB 31 is a Jones bill, very similar. The Jones bill is actually doesn't have the fines and the jail time sentence attached to it, so it's slightly better. But it's 1,000 feet instead of 500, so it's a larger swath of area where you would be unable to camp. And that is going to be in committee in about 2 weeks. And so we're trying to have another showdown and kill that bill as well. So I just wanted to highlight those 2 bills that Western Center is opposing.
Thanks, Cynthia, for sharing. I'll also mention, in addition to the bills that we sponsor, we are also opposing some bills on the healthcare side, 2 bills that relate to conservatorships, and so expanding the definition of gravely disabled, which would dramatically expand conservatorships, and that's SB 43 by Senator Eggman and SB 232 by Senator Nilo. And so we are working with other groups on this, as well as part of a coalition, and would note that this is, we see this as actually being broader than the care courts that was passed into the law last year, which we, along with others, oppose and have some active litigation on as well. But as mentioned, we do see this as broader because care courts is limited to those who are entering the justice system. This would just greatly expand the definition of gravely disabled, so one of the authors is the chair of Senate Health, and so that also puts us in an awkward position, and seeing how the care courts move forward with the administration, the governor's support, we'll continue to oppose it, but also recognize that there are some uphill challenges to not requiring people to be involuntarily conserved. It's just because of their behavioral health condition and inability to house themselves. So we do have some concerns there. I want to see if Chris has anything to add, but I also see that there are other questions as well.
We're not opposing any bills just at this moment, having conversations with folks where they can provide recommendations to maybe some of their bills. In the public benefit space, everyone loves to hug each other, so.
And it's a big day for housing. We've got a question for the housing team. Can you elaborate a bit more on SB 460, the Fair Chance Housing Bill? Specifically, can you tell us what kind of criminal background checks housing entities currently do, and what criminal background checks, if any, these entities would still be allowed to do after the passage of the bill?
Yeah, so SB 460, the Fair Chance Housing Bill run by Senator Wahab, will eliminate all housing background checks in the in advertisement, evictions, and what is that word? And allowing people to be housed. So criminal background checks cannot be considered at all unless it is federally required. So in certain government subsidized housing, project-based Section 8 vouchers, for example, there are automatic bans based on if a person has been convicted of the making and distribution of meth and certain sex offenders. So in those instances, a housing provider can not allow a person to live there based on those very specific offenses. What our bill is doing, the Fair Chance Housing Bill, is eliminating all inquiry into criminal background checks. What often we are seeing is that, and this is based on the Oakland ordinance, which was also supported, and the Berkeley ordinance, which was supported by landlords in that space. But what we're seeing is that people are being arbitrarily denied based on their housing, based on their criminal record in a background check. Oftentimes, the background checks are issued by third-party providers, and while some of that information can be directly received from FBI databases or local databases, often that information is incorrect. You know, it doesn't have disposition information, or if a felony was changed to a misdemeanor or anything like that. And we just don't think it's fair that a person can be denied housing simply because they committed a crime or didn't commit a crime, right? Because it could also be a person just being arrested of a crime. So we're completely eliminating that. The bill is set in Senate Judiciary, which is a difficult committee and not as progressive as we would like, nor as friendly to some of these issues, but we are going to work on them. Just in general, when a bill is introduced, oftentimes it's very rare that that bill will stay as it's introduced throughout the whole process when it gets to the governor. Most often than not, people will have to take amendments. We are anticipating that there are going to be some amendments. We don't know what they are yet, and that will dictate, our next steps. But in general, we just don't believe people should be denied housing simply because they had interactions with the criminal legal system. Hopefully that answers your question. I'll put my email in the chat if you have any other questions about it.
Thanks for sharing, Tina, and recognizing some of us may have 1 o'clock meetings. Do appreciate you all joining. Also happy to share our contacts. It is included in that sponsored bill list at the end. And so feel free to reach out to us. Happy to have you all join. And with that, I will give everyone back 5 minutes to do a quick bio break before their next meeting.
Thanks all. Really happy to be here.
Thank you.
Thanks all.